Good morning, everybody. It is 9 a.m. PST in Los Angeles. I am almost a new man. I finished finals. Because of COVID and some of the other issues we had with space, we changed orthopedics to a 24-week semester and a half. So last week was in the way I describe it is like landing the plane or docking the cruise ship. And these students have been with me for 24 weeks. And actually, in fact, before I start this, I want to share this little image. Let me just share this for a second here. Now, though this might not look very big, let me zoom in a little bit. What you see is Friday. It was our last mentored evaluations. This is a graded experience where each and every one of these students over the Wednesday and the Friday, 1 to 6 p.m., they are each doing a full evaluation, treatment, therapeutic exercise, prescription, and patient education, and they're being graded on a rubric. So if they do not make it, this is a comprehensive mentoring evaluation exam. And I am pleased to say that 73 out of 73 did what I would say, what we as the faculty in the back here and me and Marshall up here we stare at each other in awe of how amazing these students are at the end of 24 weeks of ortho. The first day they walk in, they have no idea what irritability even means. At the end of it, they can treat using guideline-based principles and techniques. They can all ask a subjective exam the exact same way. They can go through an objective exam within reason, doing about the same kind of things that the guidelines would suggest they would do. And we had about 10 students who were struggling that we spent extra time in the previous 2 weeks, really working on them one-on-one, and all of them. It was such an amazing experience. And it so happens that Friday, the LA County, Los Angeles County lifts the mask mandate. It's the first time in 24 weeks that I've had a chance to laugh and smile and enjoy this moment with a student. So before they all left, I had them all sit here. I gave them a little pep talk about how proud and what a thrill it was to be on this journey with them. And the entire faculty crew applauded this whole group. And so how special is that for us, right? One of the great joys, I think, of teaching is crafting young clinicians from stepping into your classroom with not much but a blank slate and navigating the immense amount of knowledge, the immense number of motor skills, and actually being able to tease out a clinician, a functional, evidence-based, guideline-based clinician. It absolutely can be done. It has breathed new life into me. Usually by the end of the semester, I am just torn up and ready to hibernate for a bit. So I don't know if any of you connect with those feelings, but I just want to really share that joy. And I think all of us relish in that. Any comments, thoughts? I know many of you are still mid-semester, so it's a busy time, but any thoughts or comments about this?
I love the fact that they're all smiling and they obviously are not beaten down. You know, the fact that you guys must have treated them not only with respect, but you gave them encouragement along the way. So at this point of the game, when they have completed everything, instead of seeing kids that look like they've just been run through the, wrung out.
Grinder.
Yes, I see kids that have excitement and energy and smiles on their face. So I would say kudos to all of you guys, because it obviously was a mentored journey.
Yes.
It could have gone obviously the opposite direction.
It really could. And today I would tell you that with the types of resources that we have and how you can create multiple exposures for motor skill development, meaning you have videos that you could augment your class with, so students don't have to watch techniques for the first time when they come to lab. They can be all pre-exposed to techniques. And when I show you the cardiopulmonary app, you can actually develop the pattern, help them understand how one pattern is different from another from the onset. And what I mean by that is you can create soft scaffolds in their mind. As Debbie and I had chatted yesterday, it is really about creating folders. It's creating places for students to store information so they can retrieve it meaningfully. So I hope to show that to you today, but I just want to share this special moment for us. And I believe many of us enjoy those special moments with our students as well. So let me go back to my PowerPoint here, and let me go right here. So today we are chatting a little bit about acute care, cardiopulmonary rehab, lines and tubes. So there's a lot of stuff going on here. I want to get going and show you around the different apps. The first question that we asked, this was my chair, in fact, who taught cardiopulm. We started teaching together. She was probably 2 years or 3 years ahead of me, over 20 years ago at Azusa Pacific. She asked me, hey, Mike, this thing you're doing with this orthopedic app you've built, where you have patients and you have descriptions of what the patients act like and what kind of impairments they have, and how you organize the examination and the treatment strategies and the treatment techniques. Do you think we could do that for cardiopulm? Because our students have never had any cardiopulm background. I said, that's a great idea. Let's do that with the cardiopulm app. So that's what I'm going to show you right now. And intermixed with that, I will say that by creating the app based on the clinical patterns, we have obviously filmed the most common examination and treatment techniques that you would use to teach in the cardiopulm class. That means that there's almost nothing that you need to teach. Of course, you want to show it firsthand, but there's nothing that you're going to teach in lab that they cannot pre-watch before they come to class. Think about what that means for students who have no idea what they're walking into that day in lab, who may or may not have any clinical pattern to make sense of the techniques they're learning. And we expect them to make all of those connections after seeing the technique for the first time. So that's another big question that I think we ask ourselves in any rehab-based profession that is heavy in motor skills. How do I do a better job at helping my students develop their motor skills? Is the best way a one and done? I'm going to show you what you need to know for the first time and the last time today in lab. And the last thing I will show you, besides a sneak peek at our new Acute Care app that we are done filming, is how do I help students play with their knowledge? I'll show you all of these cool interactive knowledge checks. Students can do them on their own, as well as you can assign them, right? So if you go into PhysioU and you sign in right over here, you'll notice I don't have to sign in really anymore because I'm always signed in. I'm always using the app. I always have it up. So that's one secret tip for you as faculty, is the more you use a resource, the more the students learn to use the resource. It is just like any textbook or any video. The more you show it, the more you use it, the more comfortable the students feel to leverage it for their learning advantage. So I'm going to go over here to Acute Care. So there are so many apps now that we've decided to help you find what you need by sorting them into groups. So here's Acute Care. And I'm going to show you here Cardiopulmonary Rehab, the Cardiopulmonary Rehab app. What you'll see is the main patterns. So we purposely built this app to identify the most common clinical patterns. And as you can see, you have your cardiac muscle dysfunction, cardiac vascular dysfunction, peripheral arterial disease, obstructive lung disease and dysfunction, and then restrictive lung. So these are the main patterns that the students over the span of the cardiopulm class are going to be learning about, talking about the pathophys. They watch a lot of their pathophys online, and they come into the classroom where the faculty member can now bring this more to life. So they watch a little video of a patient telling the story.
Well, I have been fairly active all my life, but lately I have been so tired and so weak. And what frightens me most is my legs and my feet have been swelling. And I'm having a little trouble breathing too. I need 3 pillows to sleep at night. I've had high blood pressure for a long time, and my doctor has given me medication for that, but sometimes I forget to take it and backed often.
So here is your basic story. Now, our faculty member will discuss, what did you hear that the patient is complaining about? In the pathophys lecture that you watch before coming to class, what is it about the pathophysiology that ties into her signs and symptoms? Let's discuss it. So you can create engagement from the very beginning of class. From there, of course, you can see we are meeting the needs of multiple different types of learners. Some people like to watch videos and listen. Some people want to read about the associated diagnosis, the risk factors, the reported findings, what clinical practice pattern that's related to. And then we move into, let me go back here. Let's see, there we go. Oh, sorry about that. Went too far. Then we go right into outcome measures. So here we have placed the most relevant outcome measures where available on the web. These are clickable. So we've clicked to resources on the web to kind of centralize. I mean, these are freely available on the web. Functional performance measures, geriatric considerations. So you can see that we are trying to create connections between things they might have learned in neuro, other geriatric considerations. So you're thinking about the lifespan as well. And as you go down into the subjective exam, here is a generic subjective exam performed by a cardiopulmonary specialist, 7 minutes and 34 seconds long. The students watch this as a way to model, to get a sense of what a cardiopulmonary subjective exam looks and sounds like. So this is generic. It's not related to the patient. So here are the key cues for the students to go through and ask these questions. We have also built it in such a way that we've broken out that entire subjective exam into components. So when we're doing comps, and someone like myself who's never treated in the acute care setting or a cardiopulmonary setting, when we're asking the students to do their subjective exam, we're just following this list and making sure they have asked these key questions. So these are just short snippets of how to ask these key questions. So this part here, the subjective exam, is part of our introduction to what does a subjective exam look like in the cardiopulmonary setting. And here are the components of it so that they can now practice on each other. Now we get into the pattern-specific physical exam. We recognize, so actually let's watch this little key findings video here.
Cardiac muscle dysfunction associated with congestive heart failure and cardiomyopathy. On exam, you will find peripheral edema of the lower extremities. On lung auscultation, you will hear normal breath sounds with fine or coarse crackles in the lungs. Listening to the heart, you may hear an S3 or an S4 sound. There will be decreased aerobic capacity and decreased functional strength.
So it's a quick glimpse. Every single one of the conditions has this little summary, this little key finding summary. We've also created a quick chart review. It's a generic chart review. We created this as a fake EMR so that students would again be able to get a sense of what it's like and what kind of things to look for during the chart review. So let me just play a minute or so of this.
Before meeting the patient for the first time, you will want to review basic information found in the patient's chart. Note the demographic data, such as date of birth, age, gender, and ethnicity. The physician's intake note will tell you how the patient presented on admission and any critical events leading up to it. What is the medical diagnosis? Is this a long-term disease or an acute situation? The social history gives an indication of risk related to smoking and alcohol use. It also sets a discharge scenario in your mind. Will the patient be alone? Does he need to be able to climb stairs? What support is available? Are there things in the past medical history to take into account? This patient had a previous exacerbation of COPD, or chronic obstructive pulmonary disease.
So you can see that this is just a generic walkthrough. They watch it once, and then they have an idea of the kinds of things that a clinician is thinking about as they go through their chart review. Now, when we move back to the physical exam, you'll see that there's a list of objective tests. These objective tests are often very common across different conditions. So checking vitals, doing your lung and heart sound auscultations. Here is confirming abnormal lung sounds.
To confirm an abnormal breath sound, you can use whispered pectoriloquy. You will be listening to the lungs on the same portion that you auscultated before. Have your patient whisper 99.
99.
So you have all of these different techniques. Here's assessing breath sounds, anterior and posterior chest, with the instructions below. And if I go back, you will see that many of these things are common among the different conditions, and some of the examination is very specific to a condition. It's part of the clinical pattern. So here is girth measurement for the swollen lower extremity. Here is range of motion and strength assessment in the supine or semi-recumbent, and then over to the sitting. So there's some different options depending on the patient's availability to be able to be in these positions, their tolerance level, and then the aerobic capacity assessment. So I think it's useful just for a second for me to show this video here.
Precautions for exercise. Contraindications to beginning assessment and exercise. Unstable angina during the previous month. Myocardial infarction during the previous month. Resting systolic blood pressure greater than 200 millimeters of mercury. Resting diastolic blood pressure greater than 110 millimeters of mercury. Signs and symptoms for stopping exercise. Angina, dyspnea, marked fatigue, ataxic gait, drop in oxygen saturation greater than 3 to 5%, a rise in heart rate greater than 20 beats per minute above resting, and abnormal ECG. Electrocardiogram or ECG abnormalities. Bigeminy. Every other beat is a PVC, or premature ventricular contraction. A normal beat is followed by a premature QRS, with the P wave usually hidden in the QRS complex. Trigeminy.
So you can see that this is now available for your students to reference. They're in the clinic, they're in the hospital, they're in your classroom. It follows them throughout the curriculum so that you can always re-access this. This is another one of the special things about the app, is that anytime we have the opportunity, for example, in a multiple systems class, you can refer the student back to all of these resources because they're always in one place, available in that moment. So that's the signs and symptoms for stopping exercise. Here's your aerobic capacity assessment, again, in multiple different positions, recumbent, seated, and standing. And when you get into the interventions, so we go back to past the physical exam to the interventions, here is transfers with sternal precautions, here is acute progressive therapeutic exercises, and inspiratory muscle trainer.
If you find that your patient has inspiratory muscle weakness or they are having difficulty weaning from a ventilator, you can provide them with an inspiratory muscle trainer. To set the device, you will turn the knob that's at the bottom, and you will start by placing the pressure or the resistance at 20 to 40% of the max inspiratory pressure that you found on the MagnaHelix. You will then reposition the mouthpiece. Okay, done. So you're gonna start off by breathing in through this device, okay? Just like it's a giant straw.
Okay,
Okay, you may feel a little resistance, but that's what we want.
okay.
If you start to feel short of breath at all, you just let me know, okay?
Will do.
Okay, go ahead and start. And relax.
So the other thing I want to point out here is, as you can see, there's incentive spirometer, there's splinted coughing post-sternotomy surgery. This is the general pattern. The value of having this conversation with the students before they come to lab is that they have now created a framework in their mind. They understand the pathophys. They have a picture of the patient in their mind. And you are now talking about the objective exam, how it is relevant to the impairments resulting from the pathophysiology, and what you can have a discussion. Why would we do these different types of interventions that we're about to learn in lab? Think about how much more rich and how much more prepared the young student's mind is as they walk into lab, having had and visually seen you talk through this pattern. We do this with every one of the patterns. We do this with every one of the patterns so that you can actually tease out how they are similar and how they are different. When you look at peripheral arterial disease, you'll see in the interventions that there's a claudication, intermittent claudication assessment and walking program. This is how we manage that, right? If you look at the examination, you'll see that there's peripheral circulation assessment, ABI, rubric of dependency, Wells clinical prediction rule. Okay, so the other thing I was going to mention is we have made it really easy for faculty members to utilize these videos however they choose. So for example, if I go here and I take the ABI technique, over here on the sidebar, you'll see this little arrow here. Faculty members, one, can take this technique, copy page title with link. Okay, let me make that a little bit smaller so you can see. So I've copied the page title with link. I now go here to my lab handout or my lecture and I paste it. That means I have the title as well as the URL. So when I click on that in my PowerPoint, or if my students click on it in their lab handout, it takes them directly to the video. The other thing you can do is you can copy thumbnail image. So when you copy thumbnail image and you add that here underneath the picture, here's Command V, here is my pasting of the picture. And now you have a lab handout that has videos and pictures that match your resource that they are carrying around in their pocket. So that is as simple as opening the sidebar. One other feature we released this week was for faculty only, curricular standard guide. So you can now go through and look at the curricular standards that we have matched to all of the apps that we have created. Okay, so I think this might be useful for you as some of you are going through your accreditation or you're just curious, you know, if you're using this as a resource. We are about to go through our own syllabi and connect all of these different CAPI standards. So I want to show that to you. The last thing I will show you related to this particular app. So let me go back here, go to Cardiopulm, is here's the quick access panel. All interventions listed from A to Z, including cough assist, postural drainage, diaphragmatic breathing, right? All of this, here's our postural drainage, upper lobes, middle lobe. All of these different videos are all here listed in the quick access panel. So right here. So interventions, physical exam, A to Z, you can skip. I think creating the patterns is very important for teaching students, but you can always skip to physical exam or interventions, or just type in the search bar postural and see what comes up. So postural drainage. Okay. So, and actually for this app, we are about to import it into a new structure. Very soon you'll be able to search anything you want in that particular app. That's one of the last apps we're porting over from our old system. Here is the case studies that I want to show you. These are here to help you facilitate discussion in the classroom. So if you take this patient, for example, you get to watch her story again. But this time we have added a little bit. So let me make that a little bit bigger. We have added the age, the exercise and activities, what is her occupation, the history of present illness. So if you think about what this is doing, it allows you to now put the students into little groups, say, okay, guys, we're going to discuss 68-year-old female with fatigue and swelling in the legs. Please go through in your small groups. Either it's face-to-face or in your Zoom breakout rooms, look through the case, and I want you to answer. So here's all the basic information. I want you to go through and develop your clinical reasoning. So let's talk. I want you to discuss it. And then when we come out of the breakout rooms or come out of your groups, you as a faculty are now able to just open up all of these answers. Now, students can open it too for now. So we tell students, don't open any of the answers until we are at discussion. This is your time to develop your clinical reasoning. So here, how would you proceed with your assessment? These are all linked to the PhysioU videos. So eventually, as the case goes on, it says, hey, you are auscultating the lungs and you hear this sound. What is it? So they listen to the sound. It says, what is it and why might it be present? So here is the answer that you will discuss later. I've put the answers here because as a faculty member who's trying to use case studies with my students, I hate having to turn to the page 322 to find the answers. So while the students are in the discussion, I'm quickly going through all of these answers, preparing my mind as we get ready for discussion. So the patient is exercising. We ask the students to interpret the ECG. Let's take a look at the ECG. This is what they see. We ask the students to interpret it. What is your interpretation? Should you proceed with exercise? But as they're exercising, you note a change. Now, what is your interpretation and what should you do? So if you go back to the case here, what is your interpretation? What is the most appropriate course of action? So you can see that in our minds, as we were developing this, we knew that it is valuable to create patterns to help students make sense of all the techniques that they're going to learn. We also knew that it would be very important for students to have cases to begin to apply their knowledge. Okay. Any comments or questions before I move on? Any thoughts or questions in the chat? And please feel free to unmute yourself. Any questions about this particular app, Cardiopulmonary app? Yes.
I have a question about how do you get your students to do this ahead of time? How do you assure they're watching everything they're supposed to watch ahead of time?
So let me show you one other thing that we have created for faculty to use. I do this in ortho, but we also do this in cardiopulm. Here in the sidebar, under the educator resources, there's a complementary resource. If you go to the complementary resources, you'll see teaching content. And here is the cardiopulmonary pattern recognition worksheets. These worksheets, they can do one a week, right? They don't have to do them all at once. So here's the obstructive lung disease. You download this, you link, you basically place this in your LMS, and you say, guys, I want you to go through and play through this pattern this week, because this is one of the conditions that we're going to be talking about. This is essentially a self-guided tour of the app. It's my secret nudge for them. And when they fill this in, so I ask them to fill it in and they turn it in for very small course points. I think as I'm thinking about raising my 3 boys, there's something about these small rewards. They're low stakes. We want the students to be exposed to the app as they're developing the pattern. And when I go through the app one more time, so you see, they're going through the same stuff that I just showed you. What are the kind of outcome measures? What are some functional performance tests? What is the common physical exam? Please watch the key findings video. What are these key tests and impairments? They turn these in for course points. Okay. That, if you can imagine, ortho has like 5 of these worksheets per body region. You have 5 worksheets for the entire cardiopulm course. Okay, 4 to 5. So they do these. And then when I go in and I use the resource to walk them through the app, they begin to see the true value of the app, because it's helping them to understand the world. It's helping them to see the picture of the patient. So that's where I would encourage you to, where you're able, allow your clinical expertise to be showcased as you're walking them through and helping them understand the examination and management of these different conditions. And you just leverage this tool as a visual, audio, video-based resource to actually create the soft scaffold. I will tell you that the pattern becomes more and more clear every time they're exposed to the story in a little bit different way. So that's what I would say.
Mike, this is James. There's 2 more questions in the chat. Before you go forward to those, could you go back and show the clicks that got you to these teaching content things? Just to again reinforce, because I think a lot of people maybe not know how to find what you just got to with those worksheets.
So faculty members, when you open this sidebar, this is your secret way of getting to, so if I go to these techniques, right? Or let me go back to a technique, sorry. Let me go to a technique. Oh, my bad. Here's physical exam, objective test. Here is my vitals. So in this sidebar, curricular standards, complementary resources, copy page title with link, copy thumbnail image. That's how that works. So when you go to complementary resources, you will see that you are in our website under educator resources. You can get to it through here as well, faculty resources. And here is the teaching content. So for teaching content, you go right here to cardiopulmonary worksheets. It takes you into a Google Drive. Soon, all of this is going to be built right into the app. You won't have to come to the Google Drive. We're working on it. But this is where the worksheets are. And if I go back one slide, I want to show you that here under lab handouts, in fact, we have created all of your cardiopulmonary lab handouts already. So if there are classes that are very predictable in how the classes are run, we created lab handouts for you. You can pick and choose. You can modify any of our lab handouts. So here are the intervention techniques. There's a PDF and a Word doc. So let me just show you the PDF. Here are all the techniques from A to Z with instructions from the app, with the image from the app, and it is hyperlinked directly to that technique. So that's the other way. In my orthopedic class, the students know that they have the lab handouts that have the bulk of the techniques already linked to videos. Their job as part of an adult learner is to come prepared and having watched each of these techniques once. So I make it very defined at the beginning of my 24 weeks with them. This is how you become a clinician. There's a pathway to developing motor skills. It involves multiple exposures. It's your job, because we did a survey of students. They said, when we watch videos early, it reduces my anxiety in lab. I don't feel like this is the first time and only time I'm going to see this.
I
So
think-
that's, yes.
Well, yeah, Kathy, I think, the answer about the cardiopulmonary worksheets is, directly answering your question, how do you get the students to watch the videos? But I think there's might be also a cohort effect that the classmates will go, yeah, I looked this over the night before, and I mean, God, lab was so much easier. You should do it, and so, and then if the program kind of collectively uses the app, they'll say, hey, in the ortho app, we were ready ahead of time for lab, and now in cardiopulmonary, the same thing. Just look ahead, be ready for lab, because it makes it so much easier what Dr. Wong or Dr. Kathy's going to say. So I think, and especially if they're going to be working in a group in lab, they'd be like embarrassing, like, oh, come on, you're supposed to look this ahead of time. We're going to have to cover for you or something. Maybe there'll be a cohort effect.
Right. Thank you.
Yes, absolutely. And you can see, we do this in our ortho class. We do this in the range of motion MMT class. All of these have lab handouts that are linked directly to the app so that students they get into a habit. That's how I learn motor skills.
Yep.
That's how we make our labs more efficient.
Yeah.
Right. So I think there's something to be said about having a relatively uniform resource. I know exactly how a faculty member in the year 1 class taught range of motion MMT, because we all agreed that this is the way we're going to do it. This is the video resource. It made my life so much easier. We all agree how we're going to do the neuro exam. It's always going to follow Asia, because when we get to neuro, we don't want to have done it one way in the early foundations class, did it another way in ortho, and then now they're expected to learn a new way in neuro. We just all agreed to unify to a standard way to do the neuro exam.
Mike, there's 2 more questions, but a real quick postscript here. Joshua just said that Texas Tech, they use little quizzes to get them to kind of look at kind of a little bit of a carrot versus stick type thing, I think.
Perfect. Yeah.
But then the next question is references, and then also PTA curricular standards are the next 2 questions in the chat.
Yes, good. So James will be working on adding those PT. Now, could you clarify for me, because of course I don't teach in the PTA environment. The PTA curricular standards are different, and I think we can just tack it on. Is that right, James? Is that something we can tack it on to that document?
Well, it's a different set. Yeah.
Yeah. So we that's something James and I can work on. You can look for it here in this document. We will just update the document. That's the beauty of this entire thing, is we can probably either add it in here or create a separate document. That would be no problem. And in regards to references, Susan has basically, our chair, has looked through all the key textbooks that we use. And we've basically referenced all of those textbooks and tried to be centrist based on all of those textbooks. So I'll talk with Susan and make sure that we have those references referenced somewhere in the app, probably where we will put it. One of the things we're working on is information. If I go back to the app itself, here in the sidebar, either there will be information about the app itself, or usually, let me go back to the app homepage here. Let me go back to Cardiopulmonary Rehab. There will likely be an information button that we'll add here with that kind of information. So thank you for bringing that up.
The other thing with the CAPTI stuff, there's a couple other kind of administrative curricular things you meet. Like it says, the curriculum uses a varied techniques of teaching, and PhysioU is a different, varied technique of teaching. And so you can always note that in your self-study that you're adhering to that. And there's another one to escape me at the moment where, whatever it is. Yeah. Stacy, you locked the Canvas module out until they click the field. Don't know if that's a carrot or a stick. I don't know if you can unmute and tell us what you do. Stacy Fisher. You see it in the chat, Mike?
Yeah, we can get back to that. We can get back to that. So to tie to that, just really quick, and I know we've kind of run long, but this is such a powerful discussion and great points that you guys bring up. What we've created here on the purple side is what we think students have always asked for. I want to play with my knowledge. So in the Acute Care interactive review, you will see that this first round of what we built is micro learning. They're simple, they're short, they're easily deployed. They can be used as exam or board prep. They just want to be able to pull things, the knowledge out of their head. So you have a bunch of games here tied to the acute care setting. Heart sounds, lung sounds, ECGs. These are all short little games. So for example, here, let me show you lines and tubes. Here is a course key that faculty can access. That means you never have to play the game all the way through. You can open the course key and flip through the entire game. Identify the lines and tubes in the following picture, right? So I'm just gonna flip through a few of these. Identify the line shown in the following picture. Identify the line shown. So there's, or if you go out, so let me click out of this, you go to a different one related to contraindications and precautions. You can go and take a look at all of these little games related to, let me make this a little bit bigger. What are 3 movements that are typically avoided after total hip arthroplasty done via posterior approach? So this whole game, you can assign to students, give them course points for it. And when they're done playing this, it shows up in their course record. So let me show you what I mean by a course record. So let me just see if I've done here. Let me go to a different one. If I go to any of my range of motion MMT games, let me show you shoulder flexion. There is a course record of how many times they have played it, how much time they took, and what their scores were. I tell them when you submit your learning report, so they download it. When they submit their learning report, it tells you who did it, what game it was, what the date is that this report was issued. It tells you their highest score because I'm happy for them to play it as many times as they want. This is a formative, low stakes, interactive experience. And I get to see the last 5 attempts. They turn that into me for minimal course points. I'll tell you that they end up playing it on their own because they want to test their knowledge before the exams and the quizzes. This is the things that I've always wanted as a student. So you have games here in the acute care side for lines and tubes and bracing. You have all of this heart sounds and lung sounds, all low stakes games. Any comments or questions on how to leverage this? So for example, if you took medical terminology, you would go here, copy the page title with link, and then add it to your LMS. Guys, at the end of this week, you need to play this. Turn in your learning report. That's it. Simple as that. There's no need to fuss with your LMS. All you do is create a link. When they click on it, they are logged in and they do their little game. Question?
Mike, there's quite a few in the chat. It's hard for me to understand the context. Julie, you asked, can you explain this again? How do faculty go through quickly? And I'm not sure what that was that you were referencing. And if you have a mic, I know some of you folks don't have mics, so you can't speak.
Yeah.
Yeah,
so when you click on the course, so this quiz is tied directly to Michael Wong. It's tied to the student account. So you know that they're doing their own, because when they download their course report, right, their learning report, they are basically going to, it has their name on it. The other thing is, you as a faculty member do not have access to their learning report. They need to turn it in. We're not ready yet to fully create an LMS because it's very messy. If you had to create a cohort, you have to be able to see the cohort and see what they've done and haven't done. They just get points for turning in their learning report. So that's how they do that. Let's see. Ashley, does that answer your question?
Yes, it does. Thank you. And I was also curious, like, can they do as many retakes as they want, or do they just do it once?
They can do as many retakes as they want because I get to see all of their retakes and how they did when they turn in their learning report. Does that make sense?
Okay, so their learning report is attached to every time they took it. They don't have to just select the one time they took it
That's right.
and turn it, okay.
It shows me a track record of how much time they're spending, and it shows me how they've done over time, which then makes it it's useful for me. It's useful to see how engaged the student is. So there's that, and there's the learning report here.
That's great, thank you.
Yep, absolutely. And eventually when we have, so some of the simulations that we build, I was going to tell you about the simulations. Some of the simulations that we build will eventually have open-ended questions. Those open-ended question responses will be part of that learning report. So you'll actually be able to see them reflect, see them develop their clinical reasoning.
Can I ask you a real quick question going back to the terms and on your medical terminology? Is the content more of prefixes and suffixes, or because my intro class, I'm going to be introducing medical terminology, but they haven't had anything so far.
Right. So here it will look a lot like that. Please match the following terms and abbreviations.
Okay, perfect.
Yeah. So we've tried to make these really simple because we know that students bog down and just throw it out the door if it gets too hard. Like there's a very fine balance because these are asynchronous. These are worksheets. If they keep getting bogged down, there's not enough dopamine to drive them to keep clicking. But if you make it good enough that you are checking their knowledge, and yet there is pleasure in them knowing that they are learning things because they're getting it right, you have now engaged the learner. You're using the same mechanism that TikTok and Instagram is using, except they're getting smarter, right? So this is the whole gist behind why we did it. I always tell the team, when we build simulations and games, there's a very fine balance between challenge and victory. And students need to be able to achieve enough victory and yet have enough elements of clinical reasoning teased out in these games that they take a half step towards becoming a clinician. It doesn't have to be so hard that now I have to explain every little nuance. We try to stay relatively indisputable in terms of the questions and the answers. So I hope that gives you a glimpse of what these little micro learning games are. There are a number of them here. Eventually, when you go to look on your own, you will see that there's a bunch of assistive devices, micro learning games tied to the acute care setting as well. All of these are available for you to use. And there's also some mini sims. The mini sims are case-based. They're simple. They're first-year classes. But the students now have a patient case to apply all of these principles related to transfers and gait patterns and assisted device fitting. All of these now are at your disposal. So think about what PhysioU is trying to do in arming the faculty, in equipping the faculty to create a video-rich, multiple exposure type classroom that has interactive learning built in and easily deployable. Here's very briefly, the LinesTubes app. The LinesTubes app was a request from our faculty members that said, Mike, it would be great if the students were able to be exposed to the most common wound vacs, CPMs, ice machines. So if you choose any body region, you'll see that here are the different images of the common lines, tubes, and drainage with the purpose, the placement, why it's there, and what are some of the clinical implications. It's clean, it's simple, it is there for you to leverage for you as an instructor. You can go anytime. You're talking about it in class and half the group doesn't know what you're talking about. You go right into the app and you pull it up, you show it to them, and you talk about it. It's the power of having the resource at your fingertips all the time. So that's the LinesTubes. Just know that we have also created simple case studies. Here is a very simple case study. Here is half a paragraph And here are all the answers that you can have discussions with your students. What is contraindicated regarding the line in the arm? It's just another way to play with the knowledge. More opportunity to showcase your expertise as you're crafting that clinical reasoning in the students. Okay, so in closing, what I would just show you in a sneak peek of what's coming, okay, of the Acute Care app. So we went out to UNLV, we went out to Dr. Nash, Jennifer Nash, we went out to our hospital. We filmed a bunch of stuff that we thought would be relevant for the inpatient setting. This will include things like vitals, of course, the basic stuff. Okay, so here's your vitals. This will include things like isolation. So the different types of isolation rooms. This is just a sample. You can see how we kind of mock things up. So here's a negative pressure room. Here's an animated negative pressure room for you to discuss with your students. You can learn about PPE, generic or COVID, donning and doffing. We will have videos and infographics related to it. Sometimes we've deemed infographics are just as useful. You don't need to watch a video of something. If there's something that has a procedure, a process, we have filmed all of it. There's hand hygiene, soap and water. Here's an infographic, because you don't really need to watch a video of that, or you could. I don't remember whether we filmed that or not. And equipment hygiene. If you move into the patient population, what Jen has done is we have chosen and listed the most common conditions that students are probably going to see. This will be their handbook, their survival guide. So if you go under orthopedics and you choose total hip replacement, she has gone in, looked at a number of different resources from multiple hospitals and multiple books. I'm not sure which books she's used, and you will have a cliff notes. Here's the procedure, here's the precautions, here's the contraindications, assisted device recommendations, common lines and tubes, and common goals. At a glance, cliff notes. And there will also be, if you click on the patient education side, there will be a patient-centric piece of education that you can use within the app and just send that to the patient so they can read it on their own time. Here's what's happened with you. Here's the plan in physical therapy. This is what we're going to be doing. So that's how if you think about each of these conditions, she's already written out all of these cliff notes for all of the common conditions, all in one place. Okay. If you go to bracing, we filmed all the bracing. Now, remember, we filmed all of this because as COVID hit, we had no idea whether we were going to be meeting for lab, how we were going to show them how to don and doff all of these braces. So we just filmed it all and we're sharing it with all the faculty and students. So if you go to trunk, you go to a TLSO, you have an overview.
This is an example of a prefabricated semi-rigid TLSO. It has the ability to be custom fit, so it can be adjusted for different sizes of patients or different patient needs. Ideally, it's for a patient with an injury to the mid-thoracic to thoracolumbar junction.
So you have the overview, you have videos of donning.
All right, just to reorient you to this TLSO, that on so it doesn't get stuck underneath, Josh. Okay, go ahead and roll onto your side with your log roll. And then I like to line up the straps that are going to go over the shoulder again, so I don't misplace them.
So there is videos of donning, doffing, and then there will be patient education. Patient education is something we would teach the students to read first, so they are armed with the knowledge they need to describe and talk to their patients. And the student will also know that they can send this page directly to the patient. Why do I have this brace? How do I know if it fits me correctly? How do I take care of my brace? All of that information will be here in this app. Simulations. We're into the final stretch here. We have filmed, some of them are real patients, some of them are simulated patients. COPD, CVA, LSO spine, TBI, trauma, total hip replacement, and spinal surgery. We filmed all of it. It starts with a therapist walking into the room, going through assessment of vitals, getting the patient to the edge of bed, getting the patient to standing. So let me just give you a sample here. This is a Korean patient with COPD where an interpreter is needed. So now there is this cultural component as well. So just for example.
Do you feel lightheaded or dizzy?
혹시나 머리 아프고 어지러운 거 있나요, 지금?
네, 조금 있어요.
지금 있어요? He has a little bit of a headache.
A headache? Your oxygen looks good. We'll recheck your blood pressure, okay?
옥수진은 좋고 지금
We will be building these into interactive simulations. They will be immediately deployable by faculty. They will be scored. They will be short elements of questions. Some are open-ended, some are multiple choice. And these are all this would probably what I would call a macro simulation. They're a little bit bigger. They're not really that short, but they have lots of different elements of clinical reasoning that you could build into it. So another example, here is the ambulation of the patient after CVA.
Last time we used your heavy walker. So we'll try that again today, okay? I'm gonna move your folder cap onto here. And you have your ID full to come with us, okay? Before we take off, I just want you to stand up and we're gonna recheck your balance and see how you feel, okay?
Okay.
Stand up. Nice. Good. Let's sit there for a moment. Yep, you can hold on to that one. Yep. Perfect. Stand up nice and tall. So that you're not touching the bed. Can you hold your balance without holding on to that? Very good. Your steps, okay? So when you bring this just slightly forward ahead of. Keep going.
Keep going.
So if you can imagine, as we build this game, there will be moments where the student is watching videos, and then the video will pause and there will be questions where we'll ask the student to engage into the content, ask them questions about safety, ask them questions about what are the appropriate signs for stopping exercise. There will be lots of interactive little questions for each of these games.
And then last time.
And then here's our last one. This is one we filmed. This is me faking a total hip replacement, except that we purposely filmed every possible thing we could do wrong. So in this case, it's a Where's Waldo version. So for example, here we're asking the patient,
Push through those legs.
Can I put weight on it?
Yeah.
Yeah.
Doctor says as tolerated. There you go.
so we're thinking of all kinds of interesting ways to engage the student, to test their knowledge and put them and familiarize them with these clinical settings. I really think that there's something to be said about this graded exposure idea. So that's all I wanted to show you today. I'm sorry that it took us a little bit longer, but I hope that gives you a pretty good glimpse of the Cardiopulm app, You
froze up, Michael. You still froze up, Mike.
Oops, can you hear me?
You're okay. I just heard you.
Okay, great. So I just wanted to say that I wanted to give you guys a glimpse of a lot of those apps, a lot of the micro learning that we've created, and the app, Acute Care app that's coming. And just to invite you, next week, we'll be talking about the neuro apps. And so we're just open for questions now. Does anybody have?
Two quick questions in the chat, Mike?
Sure.
not grad assistants, like outside clinicians who come in and help out with the labs, can they have access to PhysioU? You know,
Yes.
yeah, they're
Yeah.
asking, yeah, are there outside clinicians who come to the lab to help there? Yeah, and
Yes.
so,
So
Ashley asked that, yeah.
Actually, if you have adjuncts, so to speak, who are coming in to help, we will also grant them faculty access. It's all faculty get full faculty access. I believe it's a recurring 3 or 4 year. And so we just want to make sure that when you're done, or every 3 or 4 years, that we just don't have indefinite codes floating around. But